Hi, this is Dr. Carol. This is our 3 p.m. chat on mental health wellness, coping tips for dealing with difficult times. And we are definitely in the midst of difficult times, and it's hard to see where the end is. I just wanted to give you a few tips today that I think will be helpful and people have been asking me about. One is, how do I know when I should seek mental health help, whether it be crisis intervention or a regular therapy session? So, if you're having persistent anxiety, meaning difficulty with sleep, difficulty eating, difficulty feeling comfortable going outside, and I know that's very hard right now, but going outside when you need to, such as for the grocery store, um, racing thoughts, muscle tension, just feeling, consumed with worry. That is a good time to talk to somebody because a psychologist, mental health counselor, social worker can really give you suggestions on how to manage this the best way. So, if you're having thoughts of harming yourself or harming someone else, because we've got to remember we're locked into these houses pretty much with the people that are our family members, and sometimes that can be challenging. If you feel that way, you want to call your local hospital emergency room and ask if someone can see you that day to just talk to you. And though they may give you a medication, they may give you suggestions, they might refer you to therapy. So you want to look at heightened anxiety. Uh, you want to look at self-harming possibilities. And then the third one, and not that this is exclusive, but if you just feel so discouraged, so sad, so depressed that you can't get out of bed or you can't do things that you enjoy, and truthfully, some of the things that I enjoy, I can't get out and go do. Like you can't go out to have dinner or you can't go visit your sister. So that is also a time when it would help to talk to a mental health professional. So the good news is, um, right now, the insurance companies are helping people to have sessions over the computer. It's sort of like what we're doing right here, right? A telehealth session happens on a HIPAA compliant platform. There are many different ones. The ones that I use and the people in my practice is called DoxyMe. Sometimes we use the something like FaceTime because that also is compliant. Sometimes we use the actual telephone, if anyone remembers, the good old phone, talking on the phone. But we do it in a way that it is confidential for you. So I make sure that the person is in a private space. And if they're not in a private space, I might suggest that they go and take a drive and they talk to me while they're in their car. Or they put on headphones so no one can hear what I'm saying. So we make sure that the person who's calling us is in a secure, confidential space, and we make sure that we, the therapists, are in a secure place. So at the moment, I am in my home office. And the only ones that can hear me are my dogs, but they're not likely to even hear me because I have a sound screen on and the door's closed. I have a do not disturb sign on the door. My dogs can't read yet, but that one's for my husband when he's in the house. So it is totally quiet, and most of the time, if I've got them here, I may put on my headphones, my AirPods, or a different kind of headphone. So we take special care, we meaning all mental health professionals. So if you're having this thought that, it would be good to talk to somebody, this worry, this sleep problem has been going on for a while, don't hesitate. Call, check with your insurance, see what they cover. Almost all of them are covering the telehealth sessions. And what you'll also find is that, at least in our area in Pittsburgh, the local insurance companies are waiving people's deductibles and copays. So there's no reason why you can't just have a chat like this with somebody. So I wanted to talk about that because we've talked about this is a very unusual time, and it can spike feelings and trigger feelings in people that they have never had before. Now, tomorrow we're going to be talking more about how do people, what are some of the other symptoms people have, because this is a form of trauma. And it's, again, something we haven't had to think about before. So I'm grateful that for those of you watching the sessions, and you can send me an instant message. I can give you suggestions of people that you can see if you're in the Pittsburgh area, or actually many of us in Pittsburgh can see anyone in the state of Pennsylvania, and there are some ways that you can see people across state, but that varies depending on your insurance. So you take good care of yourself. Don't worry. No one would even have to know that you are having this kind of session. You don't have to leave your house, or you can be in your car, you know. Take care of yourself so that when things get back on track again, that you feel okay and you don't feel this colossal burden of stress and anxiety that's been sitting there in your body and in your brain for these weeks. So take care, and we'll see you tomorrow, and have a really good day.